This is the treatment plan for a single lower left molar. Patient's DICOM data was loaded and converted into an MHA file. Then we went ahead and rendered it 3D right here. We segmented everything and rendered the tooth mesh. Then we went ahead and converted the data and rendered the bone mesh right here. We will proceed then to trace the nerve and superimpose and look at the surface scan and convert the impressions into an STL folder as well. In this section we went ahead and scanned the impression with the cone beam machine as well, and we will take the impression and digitize it and render the surface data in a positive model from it, and this data will be merged to the DICOM data of the patient. So it's very important to take this impression in a good manner, a crown bridge quality impression. Notice here this impression was used with a tray material. It was shoved down and it was touching the actual tray because the injectable tray material is very soft, and usually assistants go ahead and seat it too harshly there. So putty would be ideal for an impression, and the reason for that again is if we look at the conversion of this into the actual positive model, we will see all the distortions that will occur. And as here we go, we went ahead and rendered the positive from the negative, and notice the distortion in this impression. Imagine now if we are gonna fabricate a guide from this impression. It will definitely not fit, especially on a partially edentulous case here or a distal extension case where we need the cross-arch stability for the guide to actually stabilize during the insertion procedure of the implant. So it's very important to pay a little extra attention to these impressions when you take them, and take the two-step process by mixing the putty of the PVS, seating it in the patient's mouth, removing the interproximal spaces, inserting the wash in it, then seating it in the patient's mouth, so you can ensure a good guide at the time of the surgery. Here the DICOM data of the patient and the DICOM data of the impression, both converted into STL files, were converted. So this is the CT of the patient, this is the CT of the actual impression, and the two were merged and placed together here. And as you can see, it's not an ideal merge because of the distortion in the impression. Once again, this step is very important because merging the two data will ensure that the guide will fit accurately and the placement of the implant will go as planned. So planning the implant now, as you can see, let me remove the cross slicer in here and the surgical guide. And if I were to peel off the tissue as well, here we will be very safe to put a 5/0 by 10 millimeters. Again, this is a very wide space because this is technically a third molar that shifted in the second molar position, and with putting a 5/0 by 10 we'd still be away from the nerve and we would be able to support the big molar in there. Once again, if you look at the data in here, we could see that it's pretty safe in there. And if we remove the surface scan now and we look at the roots that were segmented here, and we could see where the implant is going to be right there in between. The red is the nerve and the orange are the teeth and the roots that are in there. And if we look at the surgical guide that's going to be in there, here is the surgical guide removing the tooth, and this is where the drill is going to go. So you're going to start with the 8mm drill, go to the 10mm. Of course, usually you start with the start drill to put a dimple in the ridge. And if we were to put the bone in there and trace the bone and remove the cross slicer in there, notice that a little bit of the threads on the buccal area will be exposed if we remove the surgical guide. So it's no big deal because the tissue will cover it and everything will be fine underneath there. So this should conclude the treatment plan for a single unit lower molar tooth number 19.